Medical advances have drastically reduced maternal and fetal death rates in the past several decades. This is in large part due to healthcare providers intervening when complications arise, many times using induction of labor to get the baby delivered before harm is caused to either the mother or baby. While induction is sometimes necessary, it can often take a long time. Recently, we spent 4 days trying to induce one patient as none of our usual methods were working. While this is not the norm, most of our induced patients with an unfavorable cervix do not deliver within 24 hours. This is not only frustrating for the patients, family members, and healthcare providers, but it is a drain on healthcare resources. A comprehensive search of the evidence examined current methods of induction throughout the world and found oral misoprostol tablets administered vaginally to be the most effective and fastest method of inducing pregnant women with an unfavorable cervix. These tablets are 100 microgram oral tablets cut in half to equal 50 microgram doses. The half tablet is then inserted into the posterior fornix every 4 hours until contractions are regular and painful. To follow best practice, we should be implementing the use of oral misoprostol tablets inserted vaginally for the induction of labor. In order to achieve this, we will have to develop a policy and guidelines on the safe use of misoprostol administered vaginally, as well as patient order sets to ensure accuracy and consistency amongst prescribers. This will start with the perinatal committee, who is responsible for developing obstetrical policies and order sets. Next, they will be circulated to frontline staff for suggestions for improvement. And finally, revised copies will be submitted to the Medical Advisory Committee for final approval and implementation. There is likely to be resistance from staff who do not believe in the need for change. This can be mitigated by providing information to all staff regarding the effectiveness of this medication, as well as reminding them of the requirements of their professional governing bodies to follow evidence-based practice. Staff eager to implement the change can also be chosen as champions to promote this method to other staff members by discussing their experiences using vaginal misoprostol and the positive effects they have observed. Another barrier is the potential for patients to be dissatisfied with having to have a tablet inserted into their vagina every 4 hours, finding this too invasive. Ordering providers can reduce concern in this area by explaining that this medication is more likely to get them into active labor faster than other options. Patients often express unhappiness with the length of their induction and rate it as the number one thing they would change about a future induction. Implementing vaginal root misoprostol provides opportunities for women to experience faster labors with no added risk of adverse outcomes. Additionally, because we already use 50 microgram tablets orally, switching from oral to vaginal route will not cost the facility any money. No one likes a long labor. Let's put patients first and follow the evidence to implement the use of oral misoprostol tablets inserted vaginally. Thank you.